Thank you for joining this iMEDicare webinar, which will cover the theme of CAUTI reduction. We will introduce and discuss some new and highly innovative externally applied male and female devices for the management of urinary incontinence. A little about iMEDicare. We have been operating in the UK and Ireland for over 20 years as best-in-field specialists in pelvic health with a focus on incontinence management and andrological care. Urinary incontinence affects people of any age and gender and can vary in severity from mild to very severe. The bladder and bowel community estimates that 12 million people in the UK are affected with a bladder or bowel problem. Catheterization is a common procedure undertaken by healthcare professionals. It is neither simple nor risk-free. According to the Health Economics Research Unit, about 15 to 25% of patients admitted to the NHS hospitals each year will need urethral catheterization, and approximately 5% of these are at risk of developing bacteria per day. Urinary tract infection is the most common healthcare-associated infection in the UK, with up to 50% of infections occurring in patients with a catheter. In Europe, 4 million people a year will develop a healthcare-associated infection, of whom up to 37,000 will die as a direct result. A urinary tract infection is the most common of these infections, and in the UK accounts for 19% of all healthcare-associated infections. The link between catheter use and UTI is well established, with unnecessary catheter use, poor insertion technique, and prolonged catheter use as the most common reasons for infection, leading to negative patient outcomes and higher healthcare costs. Whilst there are many very good and valid medical reasons for introducing an indwelling catheter, such as urinary obstruction, or urodynamic imaging testing studies of the lower urinary tract, or administering medications such as chemotherapy directly to the bladder, we are now concerned primarily with urinary incontinence scenarios where a catheter is not medically indicated. Recall Houdini. If there is no indication, make that catheter disappear. Annually, CAUTIs affect nearly 30% of patients with indwelling catheters, leading to approximately 2,500 hospital-acquired infections daily in the UK. Traditional indwelling catheters cause significant discomfort, with patients often experiencing pain, irritation, and risk of urethral injury or damage. Increased infection rates lead to longer hospital stays, impacting bed availability and increasing NHS operational costs. So let's picture the patient context. We have an immunocompromised or otherwise weak and vulnerable male or female patient that has been using adult single-use disposable diapers for some time, and exposure to urine wetness over time has led to the development of a moisture or incontinence-associated skin damage. Perhaps there is also a pressure sore. The skin needs time to heal and recuperate. In light of the patient vulnerability, we do not want to take the risk of introducing a CAUTI, let alone cause the patient to suffer any other catheter-associated issue such as urethral injury, bladder spasm, or bypass leakage. Remember, we have no pressing medical indication to introduce an indwelling catheter. So, what to do? The solutions: for female patients, UriCap Female, and for male patients, Men's Liberty. UriCap Female is a non-invasive alternative designed for female patients, offering improved comfort and reduced infection risk compared to traditional catheters. Men's Liberty is an external pedal sheath for male patients that eliminates the need for indwelling catheters in retracted penis contexts associated with a zero CAUTI rate. Why do they succeed? Because both devices are designed to minimize skin contact, preserve skin integrity, and ensure patient comfort, reliably diverting urine unidirectionally thus significantly reducing CAUTI incidence and ensuring accurate volume measurement. Male patients can also suffer from penile retraction consequent to class 3 obesity, lymphedema, or with increasing age, penile disuse atrophy secondary to chronic erectile dysfunction. Severe penile retraction can render condom catheters ineffective. Some men simply do not like condom catheters, especially if the correct size is not available, whilst others can suffer skin excoriation or soreness over time with repeated removal. Both pads and condom catheters require multiple size SKUs to be stocked at all times, putting a strain on space and budgets. For men, Men's Liberty petal sheath can offer a very viable salvation. One size fits almost all men. Pediatric scenarios may be too small. The hydrocolloid petal adheres to the penis glands, offering a comfortable, secure, leak-proof design that directs urine immediately to the delivery tube and collection bag. Ambient skin is not exposed to urine and volumes are accurately measured. Applications can last up to 48 hours after a few practice runs. Successful application can then reduce catheter days by up to 19% on a month-by-month basis. Successful application is achieved by ensuring the penile gland skin has been thoroughly cleaned with a moisturizer-free soap or cleaning agent and is dry whilst the fixative agent and petal sheath is being applied. Patients that are constantly leaking urine can be encouraged to gently pinch the shaft of the penis whilst fitting Men's Liberty. Gentle urethral compression will stem urine leakage. It is also possible to apply a single patient multiple-use penile clamp during the fitting procedure. We offer a simple device called Kind Clamp, ideal for such an application. Men's Liberty comes in versions with a 240 milliliter thigh bag pre-affixed or just a small delivery tube. Both options have a universal drain port to which you can affix extension tubes or thigh bags or bed bags as needed. Men's Liberty has been on community FP10 for some years and is very popular amongst continence and district nurses. Both options have also been listed on Supply Chain Urology Framework since March 2024. A 16-month, 107-bed trial of Men's Liberty at an acute care facility in the United States, Kindred Chicago Central Hospital, established an average wear time of 24 hours with 0 associated CAUTI rates or adverse events, and reduced catheter days by 19% on a month-by-month basis during the trial. This study was presented as a poster presentation at the APIC annual conference in Portland, Oregon in June 2017. The QI initiative was implemented in November of 2014 hospital-wide for 60 days to determine the impact of external catheter devices on CAUTI rates in male patients. A 60-day comparison of CAUTI rates was made before, during and after the QI initiative to determine the effectiveness of the intervention. A novel male external catheter device called Men's Liberty for urinary management was utilized instead of an indwelling catheter in patients who met the following inclusion criteria. They had no restraints, no benign prostatic hypertrophy, no neurogenic bladder. They were cooperative with no urinary issues and hospitalized 2 weeks or greater. Staff received education on appropriate application of the male external catheter device, and a Train the Trainer program was implemented to ensure staff competency and knowledge of anticipated wear time, which was approximately 24 hours. The QI coordinator conducted daily evaluations to determine average wear time, ensure there was no patient skin issues or other questions or problems associated with the external catheter device intervention. The QI initiative was determined to be successful, with CAUTI rates falling to 0 during the 60 days of the ECD trial. The average wear time of the Men's Liberty was approximately 24 hours. The Foley utilization rate is listed in Table 1 for all time periods. It is important to note that the average Foley utilization rate during the 60-day intervention period was substantially lower compared with the average FUR during the 2 months before and the 2 months after the intervention. 32.5% lower average FUR compared with before and 30% lower average FUR compared with after. No complications or adverse events were reported as a result of the Men's Liberty intervention trial. The clinical implications are significant. Use of external catheter devices such as Men's Liberty can successfully manage urinary incontinence in circumstances where indwelling urinary catheters are deemed inappropriate. Ensuring appropriateness criteria are adhered to for urinary catheterization is essential for prevention of CAUTI and related complications. This 60-day QI intervention resulted in a lower average Foley utilization rate compared with the time periods before and after the intervention, thereby lowering patient risk for CAUTI. Men's Liberty was also independently evaluated by a Midwestern hospital in the United States and found that 72.8% of men would advocate for the use of Men's Liberty versus a conventional condom catheter. Both patients and nurses preferred Men's Liberty on every attribute evaluated, which included ease of application, satisfactory urine flow, stay-on security, lack of leakage, wear time, absence of skin irritation, comfort, and user acceptance. Men's Liberty has been available on Community FP10 in the United Kingdom, in other words the drug tariff, for some time as cited previously, and is a firm favourite amongst community-based nurse continence advisors and district nurses, especially for men with penile retraction or who have failed routine condom catheter trials. What about the female context? UriCap Female is the world's first truly external female catheter that does not require suction pumps, glue or tape for adherence. UriCap is made from medical grade silicone. It forms a natural seal surrounding the urethral opening whilst protecting against fecal contamination. It's a single-use device, comfortable in situ for up to 24 hours at a time, and an ideal solution for both urine incontinence management, but also obtaining a clean catch urine specimen, or urodynamics flow rate and volume measurement. UriCap is especially useful for women experiencing urinary incontinence who are physically impaired, partially mobile, able to sit, or are bedridden. UriCap is often used overnight to ensure an uninterrupted sleep whilst keeping the user's skin dry. The soft silicone flat rim of UriCap surrounds the urethra, forming a watertight seal when moist. This natural surface adhesion provides an element of the securement mechanism. However, the mainstay element is the labial skin fold bearing gently down over the entire UriCap device. Ideally used by non-ambulatory or semi-ambulatory patients, it means UriCap is unlikely to be secure if the labial skin fold is too thin or the patient is mobile and very active. With the right patient anatomical and mobility profile, the efficacy is 80% plus for urinary incontinence management. In summary, UriCap offers a safe alternative to catheterization. UriCap supports non-invasive monitoring of urine output. There is no wall or portable suction pump needed. UriCap reduces the risk of incontinence-associated dermatitis. There is no sterile procedure required. UriCap is quick and easy to apply and remove. UriCap decreases waste and the need for storage and shelf space, thereby the sustainable choice. UriCap has been developed by design iteration over time to achieve its current medically certified design features with a number of published studies investigating a variety of performance parameters. These parameters include a feasibility study, safety, performance and usability studies, and more recently a urine collection study. Ongoing at the moment is a long-term 2023 to 2028 Better Care study for women with urinary incontinence to establish the long-term benefits of UriCap. All studies have positive findings and are available on mypelvichealth.co.uk for visualization. This is a very interesting slide that visually compares landfill volumes between UriCap and single-use adult pads. If we assume just 3% of the American ladies suffering from severe urinary incontinence switched to UriCap from adult diapers, the landfill contributions would fall from a 38 five-story apartment houses to just one single five-story building in a year. In times where petroleum derivatives such as plastics are in finite supply and greenhouse gas emission reduction is an imperative component of net zero and climate change mitigation, switching to UriCap for indicated scenarios is definitely a more sustainable environmental solution. UriCap also offers a new way to safely replace invasive catheters or beakers for urine sampling, urine collection and urine monitoring. UriCap is ideal for obtaining a clean cat's urine specimen, especially for ladies that cannot use a conventional beaker or who are not ready to produce a sample in a timely fashion. The advantage of UriCap for urine sampling in a suspected UTI case are many. Clinical studies at the Lady Davis Carmel Medical Center, Haifa, have shown that there is a low rate of contamination compared to midstream urine collection. The procedure is external with no risk of causing a UTI. UriCap is very quick and easy to apply in A&E, pre-surgery or in an outpatient clinic or in a GP practice. This is ideal when it is time critical to achieve an uncontaminated sample quickly and can even then be left in situ as an ongoing incontinence management solution. The manufacturers of UriCap, Telecare, have produced an extensive range of excellent educational and clinical training resources, including IFUs, training videos, an interactive online training course that tests knowledge in stages as the user progresses through the course. These can all be accessed via iMEDicare Limited in the UK and Ireland website via mypelvichealth.co.uk or an email contact@imedicare.co.uk. As previously mentioned, both UriCap and Men's Liberty are available on NHS supply chain via the Urology Framework tender. You can see some of the product codes in the slide. So what are the sustainability and long-term benefits? Reduced healthcare costs. Implementing non-invasive alternatives like UriCap and Men's Liberty leads to fewer infections, reducing hospital stays and saving NHS resources. They're both eco-friendly. Fewer infections results in decreased use of antibiotics and disposable materials, promoting environmentally sustainable healthcare solutions. Both offer improved patient outcomes, lower CAUTI rates, enhanced patient satisfaction, and support NHS priorities, minimizing preventable complications and mortality. If we consider sustainability from the big picture point of view, the major concerns with today's solutions, such as pads and condom catheters, include an overconsumption of antibiotics due to UTIs from both pads and catheters, the transportation of large volumes of incontinence pads to and from the hospital, to and from landfill, the storage of large volumes of incontinence pads at the hospital, the large landfill sites required to hold waste disposable pads, and the incineration of up to 50% of all used diapers. And of course, the leakage of urine into the groundwater, causing over-fertilization. In contrast, small products producing small volumes of waste like UriCap and Men's Liberty address all of these issues and have a better environmental and sustainable footprint. So what are the key takeaways? Non-invasive devices like UriCap and Men's Liberty reduce infection risk the improved patient outcomes and ultimately lower costs. The call to action: healthcare providers should prioritize non-invasive options when appropriate to promote sustainable patient-centered care. Both Men's Liberty and UriCap offer safe, reliable and cost-effective solutions for the management of urinary incontinence in vulnerable patients. This reduces the risk of CAUTI, patient discomfort, further morbidity and mortality, and ultimately allows patients to be discharged in a healthy state sooner than later, freeing up much needed bed space for the constant influx of new cases. If you would like further information or to request product samples or literature, or indeed to initiate a free patient trial in your healthcare centre, please do not hesitate to reach out to us on email contact@iMEDicare.co.uk or website mypelvichealth.co.uk or telephone 01 923 237795. Thank you very kindly for your attention.